succession to the multiple choice questions what I have been taking up from pathology for NEET PG entrance exams. So in this video, I'll be again discussing starting up with the most important MCQs from pathology, and which will be there in the form of multiple choice. And in this video, I'll be summarizing all the one-liners in multiple choice questions in the form of one-liner facts or statements. So you ought to memorize these one-liners straight away so that you can just attempt one of the options out of the four options if they are given in the form of multiple choice questions. So beginning with, so today's in this video I'll be discussing about the genetic pediatric diseases. So beginning with, so the genetic pediatric diseases, starting with, so the first important MCQ, what they ask in the genetic pediatric diseases, it is about the first very important MCQ. What is frequently asked is about the maternal disomy of chromosome 15 is seen in what syndrome? So genetic pediatric syndromes, what are there in pathology? Out of the what important MCQs can be framed from them. So this is very, very important. That is the point number 78. That is the maternal disomy of chromosome 15 is seen in what syndrome? It is the Prader-Willi syndrome. This maternal disomy of chromosome 15 is seen. The next important MCQ is they ask you out of the list of the autosomal recessive and autosomal dominant traits, autosomal dominant disorders. So do remember, glucose 6-phosphate deficiency, it is an X-linked recessive disorder. Now, the next important MCQ related to genetic origin, genetic, is that is the Marfan syndrome has an autosomal inheritance. The next important MCQ is the type of inheritance which is seen in tuberous sclerosis. So that in tuberous sclerosis, the type of inheritance what is seen, it is, do remember, it is the autosomal dominance type of inheritance what is seen in tuberous sclerosis. Hemophilia, very, very important MCQ. In most of the competitive exams, they ask you hemophilia is associated with which chromosome? So it is related to X chromosome. Now, genomic imprinting is seen in, very, very important MCQ, it is seen in Prader-Willi syndrome. So genetic imprinting is seen in Prader-Willi syndrome. The commonest chromosomal syndrome is trisomy 21. So do remember, students, this is very, very important. That is the trisomy of 21 chromosome. It is this is a very multiple choice one-liners MCQs notes which has been there. So do remember, the commonest trisomy of 21 commonest chromosomal syndrome which can be asked in the form of multiple choice questions. The next important MCQ in the form of one-liner, what you ought to remember is the coarctation of aorta is common in Turner syndrome. Do remember, the coarctation of aorta is found in which of the following syndromes? So it is the Turner syndrome where the coarctation of aorta is seen. Next, now, the chromosome 22 deletion syndrome is Di-George syndrome. Very, very important. So, since I am discussing about the genetic MCQs, so related to, so this is, do remember, the chromosome 22 deletion syndrome is, it is the Di-George syndrome. Do remember, next very, very important MCQ, that is Patau syndrome is due to which chromosome trisomy? So the trisomy of chromosome 13 is causing the Patau syndrome. The next, it is the Edwards syndrome. So Edwards syndrome is, it is the trisomy of chromosome 18. These all chromosome, this all the syndromes should be on your tips, that what chromosome trisomy is causing what kind of a genetic disease. So do remember, the Patau syndrome, it is chromosome, it is the trisomy of 13 as well, whereas the Edwards syndrome, it is the trisomy of, that is the 18th chromosome. Now, the next very important MCQ is the real-time polymerase. the real time polymerase chain reaction is done for monitoring the amplification of the target nucleic acid. So do remember, students, the real time polymerase chain reaction. So for amplification of DNA, this PCR is done. So you must have read in biochemistry the PCR, that is the polymerase chain reaction. So real time PCR reaction is done for monitoring the amplification, because in polymerase chain reaction we are going to amplify the genes and visualize it. So the real time polymerase chain reaction is done for the monitoring amplification of the target nucleic acid. Now moving on to the next important MCQ is what can be seen. It is the karyotyping is done during what phase of the cell cycle? So do remember the karyotyping, where all the chromosomes are arranged in a particular sequence. So this karyotyping is done in what phase of the cell cycle? So this karyotyping is done in the metaphase. So do remember, students, this metaphase, the karyotyping is done during the metaphase. The next important MCQ is microarray is the study of multiple genes. Do you remember? Again, they can ask you in multiple choice question that microarray is the study of what? So microarray, it is the study of multiple genes. Next, karyotyping is useful in the diagnosis of what kind of disorders? So out of the 4 multiple choice questions, they can ask you X-linked recessive, X-linked dominant. So myriads of 3-4 options they'll be giving. So do remember that is the karyotyping is useful in the diagnosis of X-linked recessive disorders. The next important MCQ is small cell carcinoma lung most frequently metastasizes to which organ? So do remember, if it is the small cell carcinoma, that is the small cell carcinoma lung, if it is there, it is metastasized, it most frequently metastasizes to the brain. The next important MCQ is a simple bacterial test for mutagenic carcinogen. It is the name of the test is Ames test. So do remember, for the mutagenic carcinogen, if a bacterial test is conducted, so a simple bacterial test, what is done for the mutagenic carcinogen, it is the Ames test. In colon cancer, the overall survival is increased by screening procedure. So do remember, out of the 3-4 procedures they'll be asking you, and in colon cancer the overall survival is increased by screening procedure. Now the most common cancer affecting both males and females of the world, the out of the 4 options, very important, I'm making a star over here. Do remember, the most common cancer affecting both males and females of the world is the lung cancer. So do remember, students, this is the lung cancer which is mostly affecting both males and females equally across the world. Okay, moving on to the next important MCQ, that differentiating point between invasive carcinoma and carcinoma in situ is the penetration of the basement membrane. So do remember, this is very important. What is the difference between a carcinoma, what is invasive one, and which is a carcinoma in situ? So the carcinoma in situ is differentiated from an invasive carcinoma. It is by the just the difference, the differentiation point. The differentiating point is penetration of the basement membrane separates or helps to differentiate between whether it is an invasive carcinoma or it is carcinoma in situ. Okay. The next important MCQ is, what are hamartomas? So do remember, hamartoma is a developmental malformation. So do remember, students, hamartoma, it is what kind of a malformation? It is a developmental malformation. The next important MCQ, what they ask is the most radiosensitive cells are what? The cells out of the following blood cells, which of the following cells is the most radiosensitive? So do remember, the most radiosensitive cells in the peripheral blood smear, in the blood components. So do remember the most radiosensitive cells, it is the lymphocytes. Now the last MCQ for today, that is the P53 is known as the guardian of the genome. So students and viewers, do remember in the multiple choice questions, they can ask you which is known as the guardian of the genome. So guardian of the genome, it is the P53 gene is known as the guardian of the genome. The next important MCQ from the genetics, what they ask is Philadelphia chromosome, which is very, very important in pathology. So do remember, Philadelphia chromosome occurs due to what kind of a translocation? It is a reciprocal translocation between what and what chromosomes? Between chromosome 9 and chromosome 22. It's very, very 100 times I'm emphasizing this. This Philadelphia chromosome in pathology, it is very, very important that you ought to know before entering into the examination hall for NEET PG. So, and the PG, NEET PG aspirants, do remember I'm making a very important star over here. That is the Philadelphia chromosomes occurs due to reciprocal translocation of the chromosome from 9 and 22 chromosomes. Now, the next important MCQ, the most common inherited malignancy. So do remember the most common inherited malignancy, it is the retinoblastoma. So in the four options, they can ask you this you all need to mug up, and just the only way to crack the exam in pathology is just as there are certain points what you ought to mug up, and there is no other shortcut. So the most common inherited malignancy, it is the retinoblastoma. The next important MCQ related to the cell cycle is during S phase of the cell cycle, the cellular content of the DNA is double doubled, obviously. So do remember, you must have read in your plus 2 also, in class 12 also, this is a very basic question, that during the S phase, which is also called as the synthesis phase, so in the S phase, the cellular content of the DNA is doubled during the S phase. The next important MCQ is cells are radiosensitive in. So already I have discussed the cells are during the cell cycle, the cells are most radiosensitive in what phase? The cells are most radiosensitive in the M phase of the cell cycle. Now, the next important MCQ related to genes. The tumor suppressor gene, that is the P53 gene, induces cell cycle arrest at what stage of the cell cycle? So it arrests the cell cycle at the G1S phase. So the tumor suppressor gene, it's a very, very important gene. That is the P53 gene. It's very important when it comes to the pathology MCQs. So the tumor suppressor gene P53 induces the cell cycle arrest. So it is going to arrest the cell cycle at what stage? It is going to arrest the cell cycle at the G1S phase. Now, next important MCQ is the transition from G2 to M phase of the cell cycle is controlled by what? It is controlled by cyclin B. The next important MCQ, what they can ask is cyclin dependent proteins are. So the cyclin dependent proteins are CDK4. Now, the cells which are most radio resistant. So do remember, it is in the M phase. I've already discussed these 2 points are related. Cells most radiosensitive in cell cycle, it is the M phase, and the cells most radio resistant. So the most radio resistant are in what phase of the cell cycle? Cells are most radio resistant. So cells are most radio resistant during the S phase of the cell cycle, whereas the cells are more radiosensitive. They are most radiosensitive during the M phase. So M phase, it is the phase in which the cells are most radiosensitive, whereas the cells during the S phase, they are most radio resistant. So I'll stop over here, students. In genetics, I have discussed about this. This video I was mainly focusing upon the genetic diseases and the syndromes. In pathology, so what can be frequently asked in the form of multiple choice questions. So this video I was mainly dealing with the MCQs, what can be framed from what can be framed from pathology, and particularly the genetic diseases as well as the syndromes what are associated to it. So I've tried to summarize, that is 50, 25 to 30 points, which are very, very important when it comes to the NEET PG entrance exams from the pathology subjects. So out of these questions, there might be a probability that you'll be getting some of the MCQs when it comes to the genetic as well as the syndromic part. So viewers, if you like this video, give this video a thumbs up and stay connected for the upcoming videos. I'll be completing the entire syllabus from pathology, anatomy, physiology, biochemistry, all my one-liners, MCQs I'll be discussing in the upcoming videos. If you like this video, give this video a thumbs up. Viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Students and viewers, I request you that whosoever friends or colleagues of yours who are preparing for the NEET PG entrance exams for 2024, do share this video so that this video can help those NEET PG aspirants. Thank you for watching.